All right. So this is going to give you an idea. This is a demo of how to do laparoscopic, but I will use this approach when we do the final evaluation. So it's a win-win for all of us, right?
Right.
Syllabus says to talk a little bit about laparoscopic, even though I know you had a chapter with Chrissy, but I want to just reinforce that 80 to 90% of your cases will be laparoscopic, right? And I'm going to tell you how to do trocar placement. I'm going to show you a Mayo setup. Basically is kind of very simplistic, but I'll show you the proper order to put trocars in that sense. We're going to need some medication, so you'll be in charge of medication and saline to the field. You're going to help Sam open up. So you can open up, right? So what are we going to open up
I have
here?
a question.
Yeah.
Wait, before we start. So when I do my back table, is she supposed to open these when I open on my back table? Or
So,
hold it like we did that one?
Put that in. Ask your question one more time so that people can hear it and Zoe can hear it.
So are we supposed to open this up when I put my back table down, or are we supposed to hold it and wait until
So
afterwards?
during the evaluation, I'll have a preference card that says open or hold.
Okay.
So when you read it, you say anything that's open you want to verify. I usually take it out.
Mm-hmm.
They say they want 2 trocars. I'll put it out, right? I'm going to put the things out. They're going to need trocars, yes.
Okay.
So you're going to have her open that up, right?
Okay.
We're going to need Varus needles, yes. We're going to need trocars, yes. I said 2 5s.
Yes.
We're going to need our anti-fog, yes. Yes on 11 blade, because when you do laparoscopic, you're more likely going to use an 11 blade.
Okay.
We're going to have a 10 available in case we go open.
All right.
Does that make sense? Now, some
11's
doctors use 15, but by the book, 11 blade is
11
probably
blade.
most likely for a laparoscopic.
I remember you saying that.
So we got another 5. And I'll tell you, see, one has an arbitrator, one does not. You only need one with an arbitrator, and then you can have a couple of these without it. Because these can, once you're done with it, you just put it in the next one.
Okay.
And I'll show you that. Right? And that
All
goes for the bigger one, too. Yeah, so good to go. We have a,
Already got them.
let's see, what is this? So let's use the one that, I guess that's what this is.
It says it right
Hannah's
there,
bag.
whatever it says.
It says ball. All right, laparoscopic. We have a 3/4. What's in your pack? You have enough for your reinforced and your ring stand in there too. Okay. I think that's good enough. Sutures. Let's just open up this 2O CO2 CT2 and a chromic. I'm not going to open up this one for right now. Let's go get it. You can find 3 more of these.
3 more.
Because when we get in there, we're going to practice together. Okay.
Heard.
You can commence opening. So
Okay.
once you verify what needs to be open, don't wait on us. We need to get the. Is that in your way?
No, I'm saying like that's for the procedure today. That's for the laparoscopic. Is that where you're putting your
No. We're gonna put it on your mail.
this?
Your mail.
No, I know, but what am I supposed to do with this? Just leave it there?
If it's in, is it in your way?
No, I think it's fine right there. I was just asking.
No, it's not. It's just there for
Heard.
to bother you. It's to make you think. No, it was just there for no reason. All right. So good. You're opening up. Let's go. Nothing really changed.
They put my
It's fine. Yeah, sure. We'll open all that. Okay. So whenever she's ready, you can open to your field. And you guys can work together. When I see her all by herself, you can come. Because it's all about speed and turnover, right?
Heard. Absolutely. Ready? Ooh, that's nice.
Yeah.
Thank you. I
You're
really
gonna
like
be the
that.
nurse, so whenever they get
Oh,
medication to the field. Now, be aware of your surroundings. If I call you out, I'll go like, see, you're walking around there like you're hot and bothered there. And so be careful when you're walking around that edge there.
My sterile field.
Yeah, it's your field. So calm and
Should
collected.
I go ahead and
verify.
open this? The top of it, right?
So yeah, those 2 trays are probably going to be wait till you get in there, and then she'll open those up.
Oh, okay. So I'll have to worry about that.
Yeah. So here's the deal: like if you're working together, you can wait until she's in there, and then you can open everything up for her.
Okay.
Reason is, if you let's say you open the tray up, in my opinion, if you open the tray up, you verify everything, you go over here and out there. There's time where that can get contaminated.
Okay. Heard.
Now, if you're by yourself doing a small case, maybe you want to do that. But I usually wait until I get in and I say, "Hey, Paige, you don't mind open Paige? It is Paige, right?"
Yes.
Then I say, "Hey, can you open these trays up?"
Heard.
Okay.
All right.
Nice.
That was my first time ever getting beautiful. Okay.
I'm trapped here. We need some music. So during your evaluation, this is all good practice, and you can ask questions through this process. In my evaluation part, when we get to that, when I show you all of it, I'm not going to say a word. I'll sit here, and when I see things are wrong, I'll mark off.
I'm just gonna take this off real quick.
So that's a very good point. So I'm okay now with no eyewear. I'm okay with now with no booties. But when we get to that evaluation, I want you to have proper stuff on.
Okay.
No jewelry on. If you contaminate, you don't call yourself out. All these things I'm nicking away at your evaluation. Okay.
Hurt.
But as of now, I'm just showing you the laparoscopic. It's okay to stop and ask questions. Tie your bottom one in. You remember that? Yeah, put the weight on that. Am I going to get another YouTube sensation with your gloves?
You are.
I'll let Paige, she'll put it on
Hurt.
We're all going down to the Ford restaurant.
Sounds good to me.
A trashy burger.
Get lost in. Alright, so those cannot touch the wife cuff.
So just kind of talking out loud here, all this stuff should be second nature here, because you will have more stress when you're out there, and if you're having trouble and you're taking 20 minutes to get your gloves on, that's a problem. They're not going to wait on you. If you're having trouble or just scrubbing, they'll just start setting up. So, yeah, all this is going to be second nature for you when you eventually 3 or 4 weeks in.
I took 20 minutes?
No.
Oh, don't scare me.
Don't take offense to anything.
Oh, that's
I'm not saying you were in general. I'm just saying it's important to have these little things where you're just boom, boom, boom. Okay. You're doing fine.
Right here. Right? Yeah, until you said that. Okay.
Yeah, that was my point. Fragile. Make you nervous.
I grabbed the white, and then you grabbed the
Am I making you nervous?
I grabbed white.
Yeah.
No, white. Clean. Sterile.
I heard that they're canceling California and not allowed to go.
Thank you.
There's another fire.
Okay. Would you mind taking it off my mayo stand? Thank you.
Nice communication. That was nice. What happened? Did you contaminate that? Yes,
I did contaminate it. So sorry.
I will put that in the same
I thought it went fast, but I was wrong.
But what I'm worried about is that I know in your lab you're just saying, okay, I contaminated and you moved on. You can't do that out there.
No.
You contaminate, you throw it to the floor, you get a new one.
Yes, sir. Yes. Oh, wait, I have to put my... Oh, wait. My back table. It's not sterile yet. That's okay?
Perfect.
Okay, now you start opening up. May I please get my instruments open?
Sure.
That's contaminated.
Contaminated. I could get it.
Run and peel pack it. All right. Ask your friend and partner in crime. Peel pack it right there. Go grab that. Peel pack it for it. Here's a pro tip. Yeah, just go peel. Put in the. You know what a peel pack is?
Yeah. Where's it at?
They're in the drawer, straight ahead to your right or left. Straight ahead there. So here's a pro tip. You can open that up, but when you have these trocars page, open up and have her grab it.
Okay.
Beware of your back. Do you see your back?
Sorry, yeah.
So if it's difficult to get to the field, just open and have them grab it from you, right?
Okay.
Okay. Sure there's no straight through, no moisture.
Heard.
I agree. Okay. Thank you, nurse. Sorry for the
Can you
inconvenience.
check that for me? Indicator looks good.
Chemical indicator was good?
Yep, I just said indicator looks good.
I can't hear you. I'm the nurse in the corner. Did you check
Sorry.
that? That's why you yell. Chemical indicator is good?
Chemical indicator is good.
No strike through, no holes?
No straight through, no holes.
Outstanding.
Thank you.
I agree.
Oh,
Check the lab tray yet?
Yeah, but back it up. You see how you're close you are. Just back that tray up so that you know. Yeah. I would. That's up to Sam, but I'm going to help you guide you along a little bit. So I'll show you how it's done the first time, and then from here on out, you can still continue on. But I want to show a page how I would do it. Get your tray on. Good. Yeah, these are the two trays that need to be opened.
Yes.
Okay. Okay. All right, good. Would you like your other trays? No, go ahead.
okay.
Don't get scared. I'm not going to bite.
There. Yes,
So-
I would like
All
my
right,
trays.
so what I want, this is your laparoscopic tray. So what side is your sharps going to go on?
Over here.
Okay, so I
Well,
want this vertical room for this tray. This is going to go vertical.
Okay, so leave
So
room
get,
there.
Yep, we're going to give room. So we'll go ahead and open this up. Before you start, would you like your trays open up now?
Yes, sir.
Yeah, it's your field. You can say no or whatever. But what I'm going to do is take it up. No strike through, no holes. All right, you can grab this. You can go ahead and grab. Indicator is good.
Indicator is good.
Yeah, good. All right, good. No condensation. All right.
Oh, my
good.
back's to the field.
You are very good. Okay. Now lay that vertical.
Like
There we go. Just lay it right there. Perfect. Now we're going to get this open. Have you guys ever opened up?
Nope.
So we're done with this, right? We can just wheel this out of here. Throw it somewhere. No. Take it out of the room because if it's in the room, it has to get cleaned up. So this is open up just like your gown, right? So we have the same approach. We want to go away, side,
Side
straight
back.
first, right? So don't tear this, right? You need to tear the tape, not try to rip it off like this.
Because it'll mess up the...
Right. You want to kind of like tear it like that, right?
Right.
Since it's so small. Right. So
You said small.
I know. Oh, in the same way, right? Away,
Mm-hmm.
left,
Right.
right, doesn't
Towards
really
you.
matter, and then toward you. All right,
Hurt.
and you leave it. Now you have to grab
I
that.
can grab that.
Check for an indicator. It's good.
Indicator is good.
Now pick this whole thing up and you wait for me, okay?
The whole thing?
The whole thing. No, just the tray. Yep, you're fine. Just the tray.
You're scaring me.
Good. Watch your back.
Yep.
Good.
Uh-huh.
Good. All right. Before she puts it down on her field, you have to look up to the light for any holes or perforations, right? So this is made out of woven material. It's a muslin. It's 4 inches thick. And if there's any hole, you can see light, that's contaminated.
Yes.
So you can't put it on your table until you...
Till we
That's what
know
they're
for
going to do
sure.
on the field for reps. They're going to be like, you're good.
Oh.
That's bad technique, right?
Yeah.
Or they're like, hey, do you see this? Do you see light? Do you see anything like that? No, you're good. But the bottom line is we have to verify if you are within doubt it's contaminated, right? So you're looking for holes, you're good. So go ahead and put that on top somewhere and I'll tell you what to do with it. So what I want to do right now, and since you're ahead of the game,
Can I go
just leave
ahead?
it. Yeah, so just go ahead and start setting
Okay.
it up now, okay? And I'll get with you.
Alright.
So that's kind of the approach I want you to do to get stuff to the field for your evaluation. It's a laparoscopic camera, there's cords, there's stuff we're going to use for that case. And those are done, yeah. Don't forget to do your mail too.
Yes, sir. Yes, please.
So Sam, go ahead and put some towels on your mail real quick, because
Yes, sir.
as soon as you get like troll cards, you can just lay them right on your mail for me, okay?
Heard.
So wherever you're putting something, put it once, don't move it. So you can't put anything on your mail until you have towels on there. Preceptors hate when you move things 15 times or multiple times. That's going to create infection. Like the fomites flying in the air.
Yeah, less movement's better for stuff.
What's that?
Less movement, like moving stuff around on our back table.
Can I show you the towels? Because I'm just driving me nuts looking at your towels.
I was trying to be organized.
No, can I? No,
Yeah,
you're fine,
yeah.
you're fine. Don't get upset with me.
I'm not.
Hold this real quick.
Okay.
So what I want you to do is take this, right? Get it as close as you can, right to the edge here,
Okay.
and then just tuck this in the sides. Smooth it down.
Your tucks are so much better than mine.
Spin it. The other one. Okay. Get this as close as you can. Tuck that in.
Here.
Okay. Smooth that down. Okay. I would love for you guys to have it where it's
That's
nice
pretty.
and clean.
Yeah.
Ready to go.
I'm working on that, boss. All right.
I have the toothbrush for you.
Okay.
No, there's a toothbrush in your way.
Can you go ahead and peel pack that Anna, the light handles for me? Please and thank you.
Wait, is she too close? Right? Or am I too close?
I can't have my back to the field, right? So.
Well, you're fine, but I just want to tell you what you're doing, okay?
Okay, what am I doing?
Okay. Step back real quick.
Yep.
So this is great, right? You're okay. You can just turn like this,
Okay.
right? You can have your hand just like this.
Okay.
Here's a good thing, right? I'm not going to leave this, right? I can go over here like this. You don't have to come over here.
Okay.
I don't want to turn my back, right?
Yeah.
Because you're over here.
That's why I was nervous.
You're contaminating this.
Yeah.
So here's a rule of thumb. In front's all good. So you're working. I would like to just keep working, right? And if she comes, I just go like this, grab it, get it to my table, and just keep working.
Okay.
Just don't turn your back like that. Does that make
Sure.
sense?
Yeah.
You don't have to go like 3 miles away.
I have to go all the way away.
You come to me.
I was nervous. I
She
can't
can
turn
say
my
how
back.
far away. 12 inches to 1 foot away from this field,
Okay.
right? Okay.
Another toothbrush. You want to do
Yeah. Thank you.
And whenever you're ready, you can try to get some medication in about 2 minutes to the field and saline, okay?
Oh, I do have a blade in here. Sorry.
That was good job, Paige. That was nice.
So 3/4.
Thank you.
The key is just kind of keep moving, right? Keep going with the punches.
So if I'm running out of room, I just.
What are you? No, we'll get there. I want to get that tray off your table. Just get everything to your field, and I'll help you. Okay?
All right. Yes.
Because I hate to tell you, it's going to come hot and fast when you have a lot of stuff to open up. You
Yes.
just have to keep moving, and your organizational skills will come with time. Okay?
Okay.
I got the Ferris needle. Toothbrush. Then I have sharps. I have sutures.
Heard.
Should I just do the same thing?
Yeah. She can grab it and pinch it out, right? As long as you're kind of open up and she can grab it. Yes, that's perfect.
That's good. Okay.
Isn't that easier to get things to the field?
Yes.
Yeah. Some people might want you to open it up in a basin, but if someone's there, they'll grab it sometimes, right? Especially if you're unsure about getting stuff to the field. Because you're trying to maneuver around people and it's hard. Right?
Mm.
And I have another suture.
That's like a tie to me.
And then blades.
I'm running out of room.
This one I'll have to
You can pop that in her basin if you want.
pop in the base.
So here's another thing too. Now this is your field, right? So we're gonna get there. We'll get there. So if let's say you're setting up and there's stuff that's small like sutures and stuff, I would say, hey, do you mind opening up all the small things into my basin?
Okay.
So it's a lot easier to flip it into a basin than a table.
Then it is on the table. Yeah.
So then you can still work while your person's going to flip everything that's small. But you might have hypos, you might have syringes, you have a lot of stuff, and it's a lot easier just to put everything into.
I have a question, Miss Red. Can I put these on top of this or no?
You're good at that.
So
These.
okay,
so
while
I can
she's doing that,
open my
what I want you to do with this is grab everything out of there and give me the tray.
Okay.
There. It's okay, they're just sticky. All right, good. Tray's now good. We're done with the tray. So what I'm going to say is, for laparoscopic, and we'll grab all that stuff out of there. Grab all your blades real quick, and I want to show you. Let's say everything.
You want me to grab every single
Yeah,
thing?
put it in your sharps box. Just grab all your blades out of there. All your stuff. Be very careful. Good. Okay. All right, good. So we're doing laparoscopic, right? So I'm just going to show you. We have our suction. We have our bovie. We're going to do a count with that. Okay. But what I want you to do is put these in order here. We have our first thing we're going to have is our insufflation tube, and so roll that into here. Try to get it as neat as you can. That's perfect. Just lay it right in there, right on top. Okay. Try to get that down as deep as you can, as long as I can still see the bovie when I do a count.
Okay.
Great. Let's try to roll this up. Let's look at it since we're going to come on over. This is just a timeout scenario.
Okay.
We're not really caring about sterile technique. The key is this is going to be thrown off my field, right? So I want to make sure this is as
easy
as possible. So I like to come the other way. Hold this. First of all, I don't like that hanging like that because that's dangerous.
Yeah.
I just kind of like that, right? This has a memory to it, so it's kind of hard sometimes.
Yeah.
Okay, good. Cool. So then I want to just have that right in there, right?
And this is the same
lay
way?
that right on top. That's a nice thing. All right, so this is stuff that's going to be passed off.
Heard.
Right, so why am I putting it on here? Because
it's pretty much everything you pass
think about it. When we're ready to pass stuff off, I could just bring this whole ring stand up to the field.
Cool.
And then I can, one motion, instead of having it on the mail and everything,
everywhere.
it's a one stop for everything to be passed off. So
makes sense.
the other thing too is, since this wheel is weird, now you can get your drapes, put it in the order you're going to use it, and lay it right on top of here.
So even though it's off a little, it'll hang off a little bit.
I'm going to show you. So let's take, what's the last thing? It's the laparotomy drape, right? Then we're going to go with 4 blue towels. Let's do that.
Okay. This way. Or is it long ways? Long ways.
Long ways.
Yep.
So either 1 me, 4 you. And it doesn't really matter at this point. Just give me 4 blue towels, all nice and neat. And with the doctor, yeah, I forget what it is. To be honest with you, I don't really, no, it's fine. I don't remember. I don't really go by that too much, and people out there don't even care about it too much. They want 4 blue towels, right? Reason is because the doctor's first one is going to be up against the field itself. The other one's going to be on the outside of them.
All right. 1 me, 3 you.
Right. So I typically would grab that. Right. You can make it in half.
Okay.
Have it ready to go. So is that going to be first? Yeah, it's going to be the second thing, right? The first thing is going to be
first,
that,
and
right?
the towels
And then I would just get this and just lay it right there, right?
Okay, and that's still sterile.
This is still, anything above this. This is a field here, so this individual field is fine, right?
Okay. So then I would just keep going.
So fine, good to go. So this is level. If it's way down here, and now obviously this actually needs to be way down here too. So other thing too is do you have a doctor's glove and gown? No, you don't have that. So, but when you do get that, I'll lay that right on top of here too, right?
Okay.
So go ahead and set your tray up, and I'll go over to laparoscopic stuff in a minute. If you get a gown and a 7.5 glove, that would be great.
No, not yet.
Hold on 1 second. Yeah, it's good.
That's okay. Thank you. Oh my goodness.
It's stuck to the bottom.
Always. It's usually the right angle.
So you can take that out of there. You just hold on to it and open it like a banana. Yeah. Just one less thing for them to do, right?
All right, I got it. Okay. Thank you.
And I have the 7.5 gloves.
Thank you. Those are afterwards. And then
Come on over, everybody. when we watch. So at this point, you got everything to the field. We're looking good. We're feeling comfortable. We need to get ready for a count. So however you're going to set this up, I recommend laying this out on the tray like we showed you. It's easier to count that way. And I guarantee you 80% of the people, just be aware that this is not, and they're fine. I just sometimes people frown upon this being out like this.
Heard.
So just make sure you're not that way. You'll have some people say, oh, I was never shown that way. Just go with it, right? Don't do it then.
Okay.
But I'm okay with, because technically if it's not below the field and not 12 inches out, technically by the book you're fine.
Right.
Heard. Pull 2 pieces.
Cool. Get ready for a count.
Yep.
See how that came out a little bit?
Yeah. Sorry.
So kind of sometimes if you want to push your towel roll closer to you, and you can push this whole tray, right?
Yeah. Smart idea. Okay.
Good. Feeling comfortable?
Yep.
All right. So what I want you to do is load up the 11 and 10 blade,
Heard.
and I want to help you with the mayo. Okay.
Okay.
Beautiful. Just my anal retentive self. I like to have the doctor's glove ready to go. Always have it open.
Okay.
What's going to be first? Gown to the doctor.
Gown.
Glove, right? You can either put it here. I like to just put it right on there, ready to go, right? So I know that's the first thing. He's going to walk in, gown the doctor, and then start draping, right? And to be honest with you, the reason I show you this too, this is by CST exam.
Oh, this is.
Can you put the drapes in order from start to finish? And what is the first thing that's going to be on top? It's called the assistant's gown, the doctor's gown. So the gown, the glove, the drapes, kind of in the order they're going to use. And usually it's the abdominal, what we're showing you here, right? So that's why I was always trained to do this. Now, if the doctor, the doctor comes in, or someone comes in and wants the drape that doesn't use the doctor's, you can just move this off to the side and grab the drape. But get used to just kind of, right? You might have multiple. Sometimes they'll have it in the basin and lay them in order, but this is a good start, right?
Did you say you wanted me to put the blades on?
So let's put
already, right?
put the 10 blade back here.
Okay. Sorry.
And we'll start with the 11 blade, because we're going to start off with laparoscopic, which is a 11 blade, right?
Yes.
And this is in case we go open. So always be prepared for that, right?
Always be prepared.
Right. So we got our.
Okay.
So this is your sponges.
Oh, sorry.
All right.
Yep.
Get ready for. Are they ready to count? So I would lay these out so you're ready to count. We're not going to do a count because I just don't.
Heard.
I know you know how to count. I like to lay my Ratex. I like this. Okay, good.
All right.
You have everything here. You have your sutures. Okay.
Yep.
So what I want on here is that your laparoscopic. Let's come on over and I'll show you the stuff that's in here. What we have is a 530 lens.
530 lens.
So when you do laparoscopy, what does that mean, 530 lens?
That's how big the camera is. Like how it magnifies, like how you can see.
So it really refers to the diameter. This is a 5 millimeter.
Heard.
So this is a 5 millimeter trocar,
Heard.
which means it can fit down there.
Perfectly.
So if I have a 10 millimeter trocar and I only have 5, I'm not going to be able to get down there. Okay.
I'm
The
sorry.
30 part is the 30 degrees. See how that goes at an angle?
Yes.
So a 0 is straight on.
Okay.
30 is going to look more around the cavity at a 30 degrees. Urology uses a 70 degrees that goes around too.
I'll contaminate it real quick. I had to push my glasses up.
Yeah, go ahead.
Sorry.
But what I would do is when you're doing this and you're doing laparoscopic,
Mhm.
always look around. Check your equipment. Is it cracked? Don't put it up on your eye.
Yeah, because
You
it's
can
contaminated.
But it's important to kind of sense. Can you look through it? Can you see any cracks? I can see in there.
Can I see?
Yeah. Under my eye. Right.
Oh, okay.
So you're testing your equipment. Or if there's a crack, we need to get a new one. Don't wait till you get up to the field and the doctor says this is cracked, and it's the only one available.
Okay.
So it's important to make sure your step works, it's sharp, everything's good and work in order. Get used to doing that. So put that on your field for me.
Heard.
So what I want you to do is just kind of lay stuff here.
Okay.
So this, you know what this is?
That's the non-fog.
So it's a defogger, has defogger solution. It's also a warmer.
Okay.
So they used to have a bunch of batteries that worked in here, but you just push this and it would go on. So I like to just, once I see the patient roll in the room, turn on, load it up,
Get it ready.
walk away. Just
Right.
walk away. So what are we going to pull out? I want you to pull out some laparoscopic stuff here. We got a right angle. So lay it wherever you want on there. That's good. I was wondering if someone was going to do that. Nice. So lay it anywhere on there. So it's some kind of, I like to lay it just kind of on here. There's really no...
Like right here?
Yep.
Make room for it.
We'll go with another one. We have just a basic Draping.
The baby.
And then we're going to have hopefully a Maryland.
Should I put it right beside it like
Yeah.
that?
Yeah, we don't have another debate here. I guess we lost the Maryland.
Okay.
We're gonna have. Holy mackerel! Someone lost my L hook. I'm so disappointed. So there was an L hook in here, but
What's this?
this is a laparoscopic Kittner.
Oh,
So
okay.
the Kittner, so if they laparoscopic, they'll
They
go in
need
the trocar. They want a blunt dissection.
Cool.
Yeah, inside. So that's normally not in here. So normally I would have a, and I'll find it a little bit later. Is a L hook, but it's gone. This is a suction tip for a suction irrigator. So sometimes you'll have it up on the field if you have an irrigator. So this is an attachment to go there, but I'm not going to show you that today. Okay. And I'm upset.
What about this one? This little thing?
That's just okay. That's a good point. So when you want to aspirate, so if I give you an example, if you're taking a gallbladder and it's full of bile, you probably, if they say they want to aspirate, you probably want to grab yourself probably like a 30 cc's or some 20 cc syringe. They'll attach it and they'll go into the gallbladder and pull the bile out. So aspiration of the gallbladder, sometimes the doctors do it, sometimes they don't. But that's in laparoscopic tray. That's what that is. What's that? These are not disposable. When you have trays, you'll have a lot of, sometimes they have racks for these different instruments like this. This is just a crude example I'm showing you. No, do not. If it's metal, right, metal on it.
Pretty much not. No, if they pretty much have metal on it, they're not disposable.
Yeah, no, these are all not disposable, right? You will have some disposable. You would know the difference. It's plastic.
They're more like
you
plastic.
Put them together. They use it once, but the handles are normally not. The attachment is this part, right? And let me just kind of show you this instrument. Obviously, looking at this, right? The doctor's in there. He's working the instrument. He's articulating with his finger, so you can spin it around. Cool. So if he's in the body, he's looking at the camera. He wants to. You don't have to go move around like this. He articulates with his finger. That's cool. Now, can this be used for coagulation?
Coagulation.
Even stopping bleeding?
Yeah, you can hold it, clip it.
How?
Clip it off.
Oh, let me show.
It locks. It don't lock?
Locks, and how am I going to get heat down here?
Oh.
They all have the ability when they have this little thing sticking out.
Oh, okay.
Some do, some don't. And the doctor says, can you make this hot for me? It's not.
That's what they mean.
So they want it. So what happens is you'll get a monopolar cord that's in a peel pack, gets added to your field, you'll plug it in, throw it off, they'll plug it in the bovie, and there'll be a pedal. So if the doctor's in there, right, he's in there working around, he sees a bleeder, have a pedal, and he can just coagulate. And they say make this go hot. That's what it's referring to, okay? So they all have the ability, not all of them, but most of them have the ability to do that, no matter what the instrument is. But if I had an L hook, I would show you. L hook, it really is a long extension. Do you know that the bovie tip comes out?
Yeah, you throw it away, right?
Yeah, I'm saying if we go laparoscopic, which we are, we're not going to use the bovie. This is only if you go open. All right, but we can use this as an L hook attachment, which kind of looks like this. Right, goes in like the bovie, but on the end of it is a little L, and they can use it for coagulation. They can use the. We've seen those in Yeah, a lot of this stuff you've seen. I'm not trying to say you didn't see it.
Yeah.
I just want to make sure you guys are aware of that because you will be doing this for your evaluation, and also you'll be doing a lot of laparoscopic. Okay.
Okay.
What else can I say? We got this. So in the order you're going to use it, can we get local and salient to your field? We'll wait on that. So we're going to put this in the order you're going to use it. But think about this. How are we going to go along the field? Let's say we're going to go this way along the field. So we want to put things, so if you're going to be standing here, we want to put the order from start to finish going this way.
So I would first thing,
well, that's fine. We're going to go this way. The first thing we're going to do is probably local.
Okay.
Then a blade. Then we're going to do Varus needle.
All right.
Then we're going to put a large trocar in.
Okay.
Then we'll put a blunt. And we're going to go in that order. So get used to laying
trocar.
things. So all we need is some medication.
Okay.
If you want to have your skin marker, that's fine.
Are you ready for the notes?
Yes. So she reads an eyeball.
Okay.
Oh, my bad. What?
This is xylitine. It's epinephrine, and it expires January 19th.
Can I see it first?
Yeah, let me show you.
I have to read it first, or
let me show you how
I
I'm just going to show you. You did fine. I didn't say. Yeah, xylocaine. So it's lidocaine with epinephrine, 2%. Do you agree?
Yes, lidocaine, epinephrine, 2%.
Okay, you agree. Then you go here and say, okay, its expiration is 07/19. You agree with that?
Yes, expiration 07/19.
That's how I was taught. Yeah. Then when you hold this, you don't go like.
They hold it straight and I go
like
up.
this. I use to stabilize my hand and
And
go
I
like
go
that. You
in.
want to come at an angle, and you let me see your hand. So you pull back. I was always taught
For the air?
pull back, pull all the way back,
Okay.
and then move up and let gravity work. Even though there's a lot of holes in here, I'll show you one. So we do
Okay.
it twice.
So
Going in, don't stab me.
don't do that. Okay. Coming in.
Okay. Now push all the way in. Just push the plunger.
Oh, the plunger.
Get all the air out. Keep pushing, and eventually gravity is going to come back on it. Like
It'll just
go on
shoot
its
it
own.
out. Oh,
That's how I was taught.
that's cool. Okay, do you want me to take it out now?
You got temperature? Yeah, you got.
All right. Oh,
All right, it's just normal.
sorry.
You see how you push air and then the gravity is going to push
That's pretty
it
cool.
back
Yeah, that's
instead of
smart.
you trying to pull it.
I like that.
Okay. And it wouldn't be like that because of it. I wouldn't have all these holes and it wouldn't be shooting out everywhere. Okay.
And then this is where I'd label it.
Always label as soon as you get it.
Yep.
Now, good nurses are trained to always put it right here in case you want to reaffirm.
Her.
And always never recap these salines, right? They'll pour the saline in and they'll put it right here in case you need it. They want to give you all of it. It's not like, hey, I only want half. Because they can't recap that.
Yeah.
And why is it good to have a lot of irrigation? Even if you don't think you need it.
Because it's better safe to have it than need it in the middle of a trauma. Or
Okay, what trauma am I thinking about? You need water.
No, I'm not saying like trauma. I mean,
Well, I'm
like,
thinking, okay, what are you thinking? I'm sorry.
no, I'm saying like it's still if we're in surgery and they need more irrigation or like to see
That's
visual.
true. But I was always taught also, always have irrigation, even if you think, I'm not going to use it, if there's a fire.
Her.
So get it to your field. Because you're first Johnny on the spot, you get a boom, something on fire, saline,
Yeah,
right on the patient.
that's smart.
That's smart. That's in the book. That's how they show you in nursing school and everything. Not even in the book, it says always have irrigation on your field, no matter what.
Okay.
And again, they'll say, I want to give it all. And you're like, oh, I don't want all of it. Well, they can't do it. It can't be used again.
Yeah, so just
So
take it all.
of it.
Yeah.
You only have half.
Alright, this is sterile water and expires 06/25.
Sterile water expires 6/25. And I come right here and she goes up a little high.
And I was always taught to have a continuous flow. You don't want to have drip, stop, drip.
Yeah.
That's you contaminate the waste. So once you commit, keep going. I gotta use the bathroom.
I want all of it. I'm just playing. And then I would label that.
We don't
right?
have it, right?
So I said, yeah. So we understand we need to use all of it, right?
Oh, we
Yeah, that's what I was saying. But I was just kidding.
do? Okay.
Do you understand?
So, we're
So-
gonna use all of it? Okay, I didn't.
No, it's okay. It's all right. Listen. So I want if a nurse is going to open this up, they're going to say irrigation, right? You don't tell them, hey, I only want half of it, because what they're saying is like, what am I going to do with this?
I said all.
So just give all of it. You can't say also, hey, take some. Do you want some more?
I'll take all of it.
You can't. You have to have a continuous flow, right?
Hurt.
Keep going. You can't stop. Go like this
Because it's
That's
splashes.
contaminated.
Mhm.
because it's dripping on the sides of it, right? Continuous flow. Yeah. Just like a bottle of wine.
Mhm.
Twist and get the hell out of it.
All right. And
This-
then I label.
And buy the book for AST for nurses. Never recap. Now, don't get rid of it, right? Put it right here so they can verify what it is in case they forget.
And I would label it, but
And
I
you
don't
would
want no
always label.
labels.
Correct. All right, who wants to gown in? Both of you gown in, okay?
Are you going to be my surgeon?
I'm going to be the surgeon. I'm going to wait for them to get in so you
Sure.
guys can drape, okay? What questions?
Should I go ahead and
What?
Should I go ahead and put a suture on a needle or no?
Yeah. That's fine.
Okay. I mean, not needle, but the needle.
So think about laparoscopic is very simple. If you did do laparoscopic, you'd need a monocryl probably, or dermal bomb or dressing. Very simple incisions, okay?
Trocar. And what was the name again?
So these are all trocars.
Yes, but one of them.
This is a large or a 10 to 12 trocar. These are 5 trocars. And these are operators.
And these are for different operators.
Yeah, these are just different sizes, right? And
Great.
I'll show you today.
All right, cool.
This is a varicino. I'll show you. This is a 11 blade. This is a local.
That was my first time ever loading 11 braid. It looks different.
So you did it wrong.
Did I-
Give me a
yeah,
needle.
see?
Give me a needle driver.
I thought it looked
You
funny.
see how it's backwards?
I was like, it looks
Give me a
funny.
needle driver. and
Oh,
see.
shit. My bad.
Okay. Alright, so When you load this up, I come right here.
Always.
So this is going to see how this is coming out of the side. You want to match that up.
Oh, heard.
Yeah, so just kind of, I choke up on it, I just come out at an angle. And
Heard. Thank you. It was looking funny.
there you go.
Unhook that. Don't keep it up like that.
So whoever gets in there first will drape. We got light handles?
I do.
You do?
Yep.
I don't think you do.
Oh, they were up there. Somebody took them.
I know I have them right here.
Oh, you came back in the okay. Thank you. Just put it in my basin.
Just put it on your mayo.
Maybe.
Put 2 Raytex on your mayo, and then put 2 non-perforated towel clamps.
Heard.
Coming behind you.
2 Raytex.
What's wrong?
I would say my gown was touching the blue cloth.
And non-perforating towel clamps.
So we're going to drape. So the first thing we're going to do is a down sheet. Doctor's going to be coming in soon, but you can push it off, put that off to the side.
Should I bring the basin over? Or
Not
should
yet.
I-
I'm going to talk you through it. First, I
Sure.
want to drape.
Is it this? Right?
Okay. Back out, back out, back out, back out. All right. You have the word centered. You guys think, all right, now cuff and fold to the legs and kind of come out and just drop it.
Alright, cuff and fold. There it is. It was sticking.
And so go out by leaving this hand here.
Leave
go
this
out like
hand and
this,
just go out.
and just drop. All right, and then just what I want.
Oh, the
that's-
whole thing?
That's fine. That's fine. Well, the idea is we're going to go for the prep line, right? So,
Oh, heard.
so if we're here, right, we're going to come out here. If we had to come out, drop it, and then if we had to come a little bit here, we would have dropped it there.
Heard.
But that's fine. You committed to it. You don't want to have to move things, right? Because you don't want to move things towards your field. You can move things back a little bit or smush it in. That's great. So what I want to do now is, this is always a little complicated. You grab the blue towels. You're going to come around and do the doctor part.
Okay.
Okay. What I want you to do is just imagine that around the blue holes is where I want you to fenestrate. So the first one's going to go right here and stop. It might fall, feel like it's going to fall, but you have to get used to that. And Sam, you're going to come up with all 4 blue towels and hand it to the doctor, okay?
Heard. And then I grabbed it like this, right? So you can just
Nope, no,
hold it.
just what I want you to do is make sure that she can, or the doctor can grab that
because I don't want
first
to touch the hand.
one. Well, you both are sterile.
Oh,
Fine.
okay. Heard. I did it backwards.
Oh.
Sorry.
Just roll with it there, Paige. So, I'm going to show you. This is what I want you to do. So get used to doing this, right? Kind of coming in like this, where you're protected.
Okay.
Right? You're not coming in like this, right? Because you can accidentally just kind of touch a little bit. Just come like this. Know that have an idea where you're going to go. I want to go here where that's going to sit there. So kind of come in like this, right? And just let it sit. If it falls a little bit, fine. Okay, because I know it's a steep. And do the same thing here. Do the same thing here, and do the same thing here. Okay.
I fixed it. Or did I make it worse for you? I did.
So that's why we have a down sheet there, Paige, because now we have a barrier. So we can come up here now, right? So just kind of come in this way, where it's going to be sitting right here. How's it? Good.
Oh, her. Oh.
Good. So yeah,
Oh,
go ahead and do this one. If you want to give it to the doctor, go ahead. Doctor's already here. But if you're here, help the doctor out.
Okay.
So what you do it, right?
This way, and then I cuff my fingers so I don't touch it.
I'm going to show you.
Yeah.
So you're like this.
Mhm.
So you know you're going to go where you know where you're going to go. You want the objective is to get it like right here, right?
Yeah.
So I would just kind of come in like this. You can go over the head. It's okay. The head's there. You're just kind of coming in.
And just set it
Just
out.
let it and back out.
All
And just
right.
be aware of your surroundings, because if you're touching, you're moving. This is sterile.
Yeah.
This is contaminated.
This is the whole field.
All right. So this is where it's a little different for you guys. We got the down sheet. That's okay. We're looking pretty good, right? We got exposure to the belly. We have trocar holes. Normally it's not like this, but I need this because we need to get trocars in. We're going to grab this. So I'm going to show you. So unfortunately, and I'm not making fun of anyone, but most of these patients are going to be a little overweight and hard to get these drapes on.
Yeah.
So in this case, what I want to do is when I get to this point, ask the doctor, doctor, would you like me to take the stickies off?
Okay.
And the doctor says, yeah, I'm going to cut into the corners. And this is what he's talking about, or she. So you grab yourself a straight Mayo, if I can find one.
It's right there.
So I would say let's cut maybe about 5-6 inches inwards like that.
Okay.
Okay. And do that all in the corners. Oops. The reason we do that here is because we don't want to do it on the field because we can contaminate, right?
Right.
And then go ahead and take the stickies off. You're done with that. You need to put that back on the Mayo, that's fine, or you want to put it back here, it's your call. Probably won't use that again until the end. And take the stickies off, and then you're going to drape like it is, right? You have the head, find the center, which is going to be right here. Just come right in the center, stick it down so it's sticking pretty good, and then you guys open up normally. Let's start to anesthesia first. You cuff, give it to me, right? Give me a second. Give me a second to put it on the IV poles, and then go to the feet. Okay. But you're working as a team together to do that.
Okay.
You can't have me going all by myself and you're still over here. You're kind of.
Thank you.
So you have to kind of like go together.
Oops. Sorry.
Would you hand the stickies to the circulator or just?
Yeah.
If
If you're all by yourself and the circulators will across the room, just drop it to the floor. Okay. If the garbage is here and the circulator's here, just try to get into the garbage. Okay. But if the circulator's standing here and you throw it to the floor, it's a little disrespectful.
Yeah.
You know. So, but just realize if the doctor's waiting, there's no one around, drop it and let's go.
Yeah.
Just clean it up afterwards.
Well, just make sure you don't drop it. Okay. So this is midline. Right here.
And make sure it sticks down, push it down a little bit so it's sticky. Good. Try not to touch the skin too much.
Sorry.
You're fine. Don't worry about that.
Oh.
So stick it, and then you're going to come in,
Okay.
grab one side. So find out where the center is. So you grab one side, right? All right. Don't pull it up. So and then pull out and then walk out. And trying to leave this. I'm going to help you. Trying to leave that center. Okay.
Like that. And then
All right. Now
this is the part when we hold it. But
it's okay.
We gotta cuff it?
No, you actually have the down part, right? So this is fine.
Oh.
So kind of open up here.
Heard.
See the center?
Mhm.
This part's going to go this way. This part's going to go that way.
Heard.
So hold that in your hand
Yes,
and
sir.
verify this part.
Mhm.
So try to find the opening where you're going to go. See, do you see how this is kind of
Hold it.
caved in a little bit?
Yes.
This is if they have on the arm board out. It's going to cover the arm board. So you can actually take it one more.
Okay.
Right? Take it like this, right? And then just cuff it and then go
So we
out
don't
like
touch
that.
their hand.
Right, exactly. Right. You got it.
So it's gonna be like this.
And if this needs to move back and this is in your way, it's okay. Can you move that back? Communication is key, right? Don't contaminate and you're scared to talk to someone. And I'll grab one. You have to wait for me because let go, right? As soon as the anesthesia grabs it, let go, right? He's going to do it or she's going to put that on there. Anesthesia assistant, CNRNA, someone that's putting the patient to sleep. All right, then don't wait on them. Do the downshift the same way. So they do the same way. You cuff, you go all the way out, and then drop it over the feet, right?
So we
And why are we cuffing down there? Because you never know. There might be a Neptune down there. There
yeah
might be
something down there.
and then drop. That was perfect, guys. And
Look, it's nice.
yeah, I will take care of this part.
Okay.
So at this point, what do you do? I'm trying to figure out if you got the patient draped. What do you do at this point? What is your instinct?
To pull my Mayo, my
Let's
back
do it.
table up.
Pull your Mayo up. Your instinct is, as the other person, I want you to grab the basin and let's pass some things off. So just set your table up, set your basin up. You get the basin, come on this side, and I'll help you pass stuff off.
So my doctor would be on the other side. My surgeon, right?
It's fine. For this case, we're going to come this way, okay?
All right, cool.
My doctor, your doctor, or our doctor will be
Surgeon.
right here, okay?
So is there something we should start with? Like the,
I'm going to help you. I just want to make sure Zoe sees it. Smile. right, so you can take that white thing off. Let's put some light handles up.
Okay.
You're going to come on this side. You'll help me a little bit in a minute. But these needs a reach because I'm tall. I can
Thank
go
you.
like that. Okay. So the nurse,
sorry.
as soon as you get on there, all right, so you just go back, make sure you're pretty, make sure you're all set up back there. And what I want to do is, this is, since I'm tall, let's pass off the light cord first. But let's do me a favor. So can you put this here?
Are we able to do that?
Yeah, or the doctor will come in and do it. I just don't want to do it because we're running out of time.
Right.
Sorry.
Okay. So if you're there, just kind of make sure you're stuck around the perimeter. You're good to go. If you're seeing any white, that's what we're trying not to see any white, right? We're good to go. So what I want to do, you see these here?
Yes.
They're Velcro. Right? They open up. They hold stuff. So we're going to use that. What I want you to do is first pass me the light cord. I'm a non-sterile person.
So you gotta swing it at him.
I just want to make sure I can see.
So what part goes
maybe you can
first?
go
Yeah,
up
that's
in
the first
back,
thing.
just so I can see it.
We did it on order. Remember?
And then we'll get you in the flow, okay?
Okay.
So what I want to do is, which end are you going to pass off to me?
My left.
Okay.
Is that
Are you sure? This is the last cord I have. It's a 50-50 chance.
am I right?
It's the wrong one.
Is this the wrong one?
Yeah, so this one's actually going to, I'm showing you, that's the lock and that's going to go on the light cord, okay, or in the
Oh.
camera.
Okay.
So what I want you to do is grab
That
it.
side.
This side's going to be passed off, but
Yeah.
make sure you have. So let's say you're the nurse. Back up a little bit.
Okay.
And I can come up, right? I'm good. And I'm pass this to you. I'll go like this.
Okay.
Ready? That's how you do it.
Okay.
But make sure you have enough slack, right? Because you can't come back.
Yeah.
So I'm going to say, all right, that's good.
A good nurse won't reach over your field because it's sterile.
Yeah, you don't want the nurse going like, hey, yeah.
Yeah.
So you have to try to swing it to
Swing.
me like a pendulum, right?
Okay.
So that means you have to come in a little bit further here. This is all sterile. You can
Yeah,
come
you're
on up.
sterile, so you
This
can
is your
touch.
field, right? So
Yes.
come on and swing it. And I
Swing
want
it
to stand
on.
just like this. I should be technically
But leave
staying
enough
12
room.
inches to a foot away.
Yeah.
You're going to have to kind of like...
Good job.
All right, now what I want you to do is you have enough slack. The objective for you is to have it here, tied here, and have it kind of come in here in the very end of it, okay? And you're going to do that with the same...
Good job.
Lights on,
Oh, look, it's on.
stand by. Here we go. Do the same thing with that camera cord.
Okay.
Now this part, the head is going to be going along here. The head's going to be here. So the part you're going to pass off is that part. But again, make sure you have enough slack to make this.
There's a lot of memory to it, so it's kind of a little complicated.
It does. It's been used so many times.
Yeah. Yeah.
Yeah, good.
Good job.
Got enough slack? Because if I keep pulling, you're not coming back, right? Make sure you, typically a good nurse is just going to pull, but try to get that knot out too, okay? Okay, good.
Good job.
There you go. Tie it, all right, now put it in. And so you guys know, see that red dot? Match up that red dot right with it, okay?
Okay.
Yeah, come on. Good. All right, so we got the camera light cord. We got the installation. We have to pass that off too. And we're not going to pass off
Not
suction.
this one.
We'll leave the suction and the
There you
bovie
go.
until we go open. We're not going to use that today.
Okay.
So the lure lock end is what you're going to keep, and I'll have that blue part. But what you are going to do is just kind of pass it off to me, but then you're not going to go down here. You're just going to wheel it here so it sits in a little roll but tied down there. Was that even English?
Yeah.
Oh, that was dangerous.
That was dangerous.
Yeah.
You said just.
So when in doubt, if you're having trouble, just give it to someone on this side and they can
Okay.
pass it off. But make sure you tie that down, okay? And that is an insufflation tube, right? Does anyone know what gas goes in that?
It's not the. Is it? It's not the carbon, right?
It is carbon dioxide.
Oh, okay.
Really good. And okay, so for you need to make sure your camera works. So hook up your camera. You know how to do that. You should be an expert by now.
Yeah, I am.
So we checked it. We made sure there's no cracks.
Mhm.
Right?
Yep.
So this is your camera. Hook it up.
All right.
Get your camera, like you have your camera head and you have your light cord.
Okay, so this is.
So I'd advise getting used to how to put this together. Do not wait to the point where the doctor's like, hey, put that together. And you're like,
Okay.
practice. Put it together. Make sure you know how things work.
Okay.
Because that's going to, you won't be embarrassed then.
And then where would the light go?
Okay. Just kind of use your spot on. So But do you see how I don't have a lot of slack here?
Yeah.
So you can, but see how now you're pulling?
Oh.
So, but we can't do it now. So just be aware of that. So the doctor's like, hey, I don't have enough. You can't be pulling. And we're like, oh shit, we're stuck.
Okay.
This is going to go on this, has so much memory. Right here, guys. Right on here.
Right.
Okay. And then we're going to white balance, right? So how do we do that? We don't want to do it on a Raytech by the book because it has holes in it, right? It's not really a good
You want
technique.
to use the little.
Can you
Probably
use that?
something that does not. Right? So a good rule of thumb, just lay it down. We're going to turn it on. So tell them to turn it on. We'll turn it on. Lights on. You have
Lights on.
And we'll do stand or white balance. Watch the screen. Watch the screen. And oh, it doesn't work. It's broken.
What does that do? Oh, right there. Right balance
Yep.
complete.
All right, so what that's doing is, if it's not white balance, you're going to go in the belly and blood's not red, it's brown.
Huh.
And you want things normal color.
So you want that white balance.
You want a good white balance because if
Sure.
you're in there and you're looking at anatomy and it's not the right color, it's a little confusing.
Yeah.
Right?
You're not going to know what to do.
Red, and when you see red and it's brown, unless you're colorblind, it doesn't really matter. But so good, we're white balance. So what do we need to do now after we're white balance? We're going to leave the light on?
No.
All right, so let's put that on.
Not until we're
standby.
inside.
So your job is to make sure, because this will burn right through there instantaneously and burn that patient,
Sure.
even though this patient has no legs.
Okay.
Stop. Second stage. Okay.
Okay, so we're looking at it. Good.
All right.
So lay this here.
Okay.
Put it right back on. Here's fine.
In case of
Lay that
default.
down here. We're good to go.
Just like that?
Okay.
All
I'll
right.
leave this here in case we need it, and I'll show you why in a minute.
Okay.
So who's going to gown the doctor? I guess that's going to be Anna.
This, okay.
So Anna's going to gown it. Make sure you have the doctor's gown. You're
Yep,
good.
it's over
Coming in.
there. It's ready.
You're going to play the assist. I'll play the doctor, and then we're all going to play a role, and we're going to do this in the dark.
All right.
Good morning.
Hi, doctor. I'm search tech today. My name's Anastasia.
Nice to meet you. Okay. I'm just going to do my back. Someone. Can you move my hands down? I get used to doing that. Doctors are prima donnas. I know everyone forgets. Let's start with my right hand first.
Is that too tight?
No, it's fine. It's wrong. It's wrong. It's wrong. It's wrong. It's wrong.
Oh, wait. Yeah, I'm sorry, doctor.
Use that as a landmark. See these numbers, the letters, the letters or the numbers or whatever that writing is has to be facing me and straight on, and then go into your motion. Okay, good.
Good job.
Nice job.
That's nice.
And that reassures me. I know which way I'm the right way. I
Sure.
see the letters; they're facing.
You got to face the surgeon.
And to me, I use that kind of idiot philosophy. Otherwise, I get confused sometimes. Good. Nice. Good job.
I'll take it off. Oh, hurt. Spin, spin, spin. Thank you. And then stay on the field.
All right, time out. This is Jim Bob. We're doing a laparoscopic gallbladder or cholecystectomy with the possibility of going open. We had a fire risk of 2. Do you guys know about fire risk? What does that mean?
That means about the air. That's the.
There is
common-
fire risk 3, 2, 1. Why is it put in 3, 2, 1?
Because the carbon dioxide is another.
Which one's more severe, 3, 2, or 1?
3.
3 is, and why?
Yeah, that's where the patient's head is.
Okay, and why is that?
That's where
It's the fire triangle.
fire triangle.
Oxygenated
Oh,
environment,
that's right.
a source, and ignition. Anesthesia gas is here. So when they get these little pools, that's more risk.
Hurt.
As it gets a little farther away from anesthesia, it's less of a risk of fire.
3, 2, 1.
And so fire risk of 3 or 2, right? And so we have, what kind of local do we have?
We have the epi
Yeah.
with what was lidocaine?
Just make up something.
Oh, epi with lidocaine.
So when you are saying local, we need to be able to read what's on here.
Mhm.
Because they'll say, give me that. And if it's not legible,
Yeah,
right,
of course.
like, what's wrong with you? Right?
Yeah.
So
Epi
here's
with
another
lidocaine.
thing. Do you have a skin marker or no? You do not.
I do. It's right here.
Let me see. Okay, so this is a skin marker. There are markers that are permanent markers. Do not label with a skin marker.
Hurt.
it's going to bleed all over the place.
Yeah.
So make sure, because there's markers that have a skin marker, and on the end of it's black, it's a permanent marker.
Right, with the permanent.
Right with permanent. Otherwise, when you write, and by the time you get it,
It's going to bleed out like that.
It looks like, yeah, you can't read it. So the doctor can't read it, you can't read it. We don't really
We're
know
in
what
trouble.
it is, right?
Yeah.
And if you happen to leave for lunch and someone can't read it, that's not good for that scenario. All right, take a deep breath. You got my assist. We can move that back. That's only if we go open. So let's talk about laparoscopic. What's the purpose of laparoscopic? Anna. Yeah. So we have laparoscopic gallbladder. What's that? One more time.
To not invade,
Not invade colon. What was that mean? Not invade.
like not be invasive to the body.
Non invasive. Very good. So it's minimum invasive. Okay,
Yes.
good. Okay, so we have something called cannulations, which are trocars,
Cannulations.
right? So this is a minimum invasive approach to access the cavity, right? You can have a laparoscopic, which is arthroscopic for the knee. You can have laparoscopic, which means abdomen, right? So let's talk about what's this? It's called an insufflation tube.
That's for the carbon dioxide.
Okay, very good. And that term is called pneumoperitoneum. Pneumo means gas, and obviously the peritoneum is the cavity.
Yes.
And why are we putting CO2 in here?
So you can get a visualization. It'll come up
Right, you
to
want
blow it up.
to distend the belly so we have good visualization. Right?
and more room to move around
Very
while you're in there.
Very good. So we want to make sure that we're not. Also, we put gas in there so when we put trocars in, we're not perforating the bowel.
And
okay?
also, when the belly inflates up, you can hear, like, you touch it, and you know it's.
Right. So, good. So, we were plugging into our machine, whatever side. There's a nominal pressure it needs to be at. Do you guys know
Nominal
what that is?
pressure.
And that's a CST question. I'm going to ask you 1,000 times.
Okay.
12 to 15.
12 to 15, nominal pressure.
So,
12
you
to
watch over
15.
here, it's going up and down, high, below, but a good pressure is the 12 to 15.
To 15.
What happens if it's 25?
I was going to ask you that. Then shut it down. They don't. The belly.
Well, you're going to
explode.
start putting pressure. You're going to have anesthesia, see what's going on.
Yeah.
Put pressure on that vascular system, right?
Sure.
Things are going to be highly pressurized.
Yeah.
Kind of hard. And if you're putting pressure on the belly, you're putting pressure the diaphragm and lungs and
Everything
so forth. What
else.
happens if it's 8?
It's too low, so it's
Right.
going down. You won't be able to see.
Right. You'll be looking at that monitor, and suddenly a doctor's like,
It's getting dark. in
like, you ever see that where the Willy Wonka has the room starts to shrink?
Oh yeah.
Yeah, just don't lick the kumquats.
Yes, sir. 12 to 15.
12 to 15. So we're going to go through the motions of putting trocars in. So,
All right.
so I want you to make sure this is the order we're going to do it, right?
Yep.
Local,
Local,
blade,
blade,
Varus needle.
Varus needle.
Local, blade, trocar.
Local.
Local, blade, trocar. Local, blade, trocar. Okay, well, the reason I have these up
So
here.
we do local every time we do a different one?
I'm going to show you why.
Her.
Okay, now, most doctors will put local in each trocar site.
Oh.
This is designed for the grab onto the skin and pull up. So if they're having trouble to get trocars in, they'll have you hold it and they can get the trocar in. So sometimes it's good. And I would have the sharp. Did I say non-traumatic?
Yeah, you said
non-traumatic.
You would need a traumatic.
It's fine. We're not going to use them, but just so you have an idea.
Okay.
And I always have some Ratex in case there's bleeders.
I heard.
Now, if you have epi in these local, it's not going to bleed a lot. But you know, if you don't know now, epinephrine is a vasoconstrictor. It's going to help with the duration of the local longer, but it's also be a hemostasis. It's going to prevent bleeding because it constricts the vessels.
It's constrictor.
So if you have local or epinephrine in your local, you probably won't have a lot of bleeding. But it's good to have a little lap of our Ratex available in case the
Just
doctor
never
wants
know.
it. He wants
Yeah.
to bleed, stop a bleeder. So it's good to have a couple of them up there. All right, so when I get to the point, I'm going to ask for it, and then you'll see kind of a routine.
All right.
Local,
so,
please.
Local.
That's perfect. So, all right, we got epi in here. That's it. Lidocaine, you'll probably read it. All right, injection. Now, just kind of rule of thumb too. In the
Yes.
real world, see that's an 18 gauge.
Uh-huh.
You don't want to inject with an 18 gauge.
No, that'll hurt like hell.
20, 25, typically in that
Hurt.
range. So if you're going to draw up, and most likely
We usually switch the tip,
you
right?
switch it out, right? Local back.
Okay. Blade.
Blade. Outstanding. Incision. Varus needle.
How would
Engage.
I pass this?
Like a pencil.
Sorry.
Same way we were doing it. Typically.
Just like this?
Mhm.
This
Okay.
way?
Yep, perfect.
All right.
There's now you're going to help me. Can I get the, this is the insufflation tube, and so it's a lower lock, right? It's just going to go on and lock on.
Okay.
And this is broken, and typically it'll close, open. And they'll say low, oh, not my voice. They'll say low pressure, Just hold that just like that. Low pressure, belly starting to inflate, right? Now we're going to put the other trocar in. Now, good, local. And there's a rhythm here, right?
Yep.
And we're going to put the camera in now. Injection. And typically the most common port to put in is the umbilical port, right? First. Umbilicus. Oops. Yep. All right, so now this is a good thing. So this is a trocar, a large one. See how that's open?
Mm-hmm.
That's closed. You always want to give it to them closed.
That's close.
Now if it was open and you put that in,
the air
you start smelling like
shit.
ass.
You know, you
The
put
belly's starting to shrink a little bit. Like, ah! So just get used to putting that open.
Okay, so it's closed, like,
It's closed now, right?
okay.
So we're going to take that out and we're going to get the camera. Now we need to do this under observation. Can I get the camera, please?
Yes, sir. Camera, coming right away, Doc.
But before we do that, we're going to
Oh.
switch these over page, okay? We're going to take this off. Oops, we're not breaking it. And we're going to put that right here. Varus needle. We're done with the Varus needle.
Great.
All right, look at it, we're losing gas. Oh, right here, right? That's for the balloon. And now we want to turn it on. High flow. And now we just switched it over, okay? So that's a good example. Some people don't even use Varus needles. This has the ability to get CO2 in it too.
Heard.
So some people start with a Varus needle and then switch
And then
over.
they switch over
Okay.
to a trocar.
All right, we got that. Now we get camera.
Camera,
Now you can
coming
help
right
me.
away, Doc. And then I'll just take this off. Oh,
Camera. Oh,
what is that? The light is on.
camera in, please.
Camera in.
Come on, let you know what you're doing. Paige,
Nope.
you're my assistant.
Okay.
So we're watching up here. Man, I feel nauseous.
Oh, look.
See this cat. So looking at this, right? Do you see how it's looking? Maybe I want to burp this a little bit. So, see how it's looking down?
Yeah.
Now, this is always going to stay. The camera head, these little buttons are always going to stay on top. When you want to look the other way, you want to move this. You see my hand?
Yeah.
This moves up. Now,
Oh,
do you see how I look? I look down now.
Mm-hmm.
See how dirty it is? Is it foggy to you? So
Yeah.
good. So let's take it off and
Kinda.
clean this. This is
Yeah.
what this is for. Clean it
Oh,
off. There might be some blood on there.
something.
Right,
Really.
something on. Let's see that helped a little bit.
Yeah.
A little better.
Oh, yeah.
So we're looking down now. So do you see how this is facing up? Let's say if I want to see the trocar holes now, we want to switch this.
Oh, that's cool.
Do you see how we're looking upwards
Heard.
now? That's that 30-degree aspect to it.
Heard.
So since you're gonna help me. So we're gonna put trocars. Do you see how I'm palpating? See how I'm doing that?
Yeah.
You're gonna hold the camera.
Me
No,
or-
you're
sorry.
gonna hand me stuff. Right?
Heard.
So make sure we're done with that. Put it in the back table. We're done with the blade. Put it in the back table. Just joking. We're not done with the blade. We're not done with the local either.
I thought so. You
I know I'm brain farting. I'm tired, you guys.
Okay. All right. You ready for me?
Give me a second. So you're good. You're in charge of the camera. And I'm sorry, you typically have to look over here.
Okay.
Normally I would have another monitor here and you have a monitor here, but that one's broke, okay? So I'm going to have to turn. So see, now when I say center, make sure you center that. If I say go in, go in. If I say come out, come out. Does that make sense?
Yes.
So center that. Center, come out a little bit. All right, good. Oh, you're not center. Stay right there. Local. So you're doing everything under observation. Injection. Blade. Good. Follow me down, follow me down. So you're in charge of the camera. Follow me down. All right, stay right there. Perpetrator out. All right, so you're going to put that right into here because you're going to use that again. All right, so now we have to follow me another roll. Let's go. Follow me over. See my finger. Center that for me. Awful. Now we're done with the stuff. You can go. Let's try something else. I don't like that hole. Let's come over here. Let's go right there. There, right there. Local.
Sorry.
You thought wrong.
I did. You're right.
This one just wasn't staying in. It's broke. Okay. Hey, but you can see how there's a routine.
Mm-hmm.
And Eventually, he's not going to be saying "wobble." He's going to get a
You
hand
just
out.
like boom, boom, boom.
And so it's a good anticipation. What do I need next?
The usual car.
There you go. Good. Follow me down. Follow me down. Follow me down. Okay. Can I have a? Give me an instrument.
What would you like, sir?
Let me see me something.
Anything? Pass like this?
Yeah. So if you're the doctor, you want to go just like this.
Okay, so I'll just like this.
There you go. Perfect.
Perfect.
So you're gonna follow me down. See, you see me over there? I want you to follow me down so we see me. Now you probably want to spin
Back
this
up.
up, right? So you don't have to hold on to
This
that.
part.
Just this part that's here. Spin this up. Okay.
You got it.
So keep going, keep going, keep going,
All the
keep
way.
going, keep going, keep going. All right. Now you have to find me again.
Go it down.
You have to get used to left. There you go.
There you go.
Got it? Now can you come out a little bit? This is just has to be burp.
That's just in the way.
Nah, it's just too far in. Alright, go in, all right. That's fine, man. I feel like I'm in your way. That's the problem.
No,
It's hard.
it
is
is hard. Yeah.
All right. See,
I
if
can
you
only
look at,
imagine.
I want you to find me the center of this. See my tips?
Mm-hmm.
So
Yes.
kind of come in here like this. A little bit of a view. You have to come in, but what my goal is, I want to grab Felix, and everyone's goal is to do that. I'm gonna have Anna come in first after I'm done and play this. So I want you, Anna, watch what I do here. I'm gonna grab Felix, but you see how I can articulate this around?
Yeah.
So kind of
That's
come in
cool.
here. You have to help the doctor out here. The whole idea is to try to get in here. God, this is harder than I thought. Come here, Felix.
There
Grab
he
him.
is.
All right, follow me around here. See that cup in the back?
Mm-hmm.
That's where I'm going. Follow me. Why don't I, you have to make sure I see my specimen, okay? All right, and put him in the cup.
Good job, Paige. You went right up to it.
Get it?
Oh.
Jesus. See, I just busted
You
the
just-
vessel. All right, let me get Felix back at it again. Please,
Oh, so Mr. Brad, so
no,
the assistant will be
follow me. Why am I off in the distance? Oh my God. Come down, come down, come down. Come down. All right. Very good. What was your question?
so the assistant will be holding the camera.
Yes. Or tech. Never know.
Sure.
Let's try in here. This is probably an easier angle. Come find me the my tips again.
Flip it, remember?
You can
Flip
it.
this. It'll go
Flip it.
up.
No,
There you
good.
go.
Now follow. All right, I'm in now. Flip it now.
Now you flip it back down. Good job.
Easy. All right,
Oh.
good. All right, this is probably easier. I'm gonna come with this hand. So I feel like I'm looking like that. So come here, Annie. Hold this. Your job, doctor. She's your doctor now. Don't piss her off.
Heard.
Do you see this?
This is over.
This always has to be like this, parallel.
Yeah.
Not sideways, parallel.
Okay.
So you're looking like this, or you're moving around, but make sure this is always
Parallel.
parallel.
Okay.
So you see the tips, right? She's going in, kind of follow her. Her objective is to get Felix the cat and put her in the cup.
Heard.
I gotta break this, buddy.
Heard.
You got exactly 10 more minutes to play around, have fun with it, and then we're breaking, okay?
All right.
Because it's almost 4.
All right.
Everyone has
Gotta
to
find
take
the
a
cup.
try and get something in a cup. And everyone take a try with the camera too, okay?
Shit.
Don't say
Oh.
shit.
Damn it. It's
I'm
really
not the
hard.
best.
I know. I don't know.
She said, damn it.
Bleeding. I'm a bleeder.
You're try to
It's really hard.
that shit is so hard. Then push up to it. So there you go.
Okay.
Oh look, that's good.
Here we go.
But
I can't get to that
yeah.
so I gotta go to a different place.
yeah.
Let's go to that one.
Yep, that one over there. Good idea, Anna. Oh look. Woo! You got it. Now you can take him out. That's his name, Felix. Take Felix.